to get a.
There we go. All right. Thank you everyone for attending this afternoon's webinar on our draft reference premium development. I'm Adam Plain. I'm the agency manager with the Nevada Health Authority for the Public Option Program. Today's webinar hopefully will be brief, but we're going to go through the data call template that was sent out to support some of the development of the 2027 plan year draft reference premium. Just as a note, this webinar is being recorded. The webinar will be posted along with a deck of the PowerPoint slides to the Nevada Health Authority website when it's completed. There will be a chance to ask questions and provide feedback on this draft reference premium development at the end of the presentation. I would ask if you have questions or feedback related to any other component of the public option program, whether it's the reinsurance or anything else, please save those questions for a later time. We will have other opportunities to address other comments and questions and concerns. This is solely intended to address the 2027 plan year draft reference premium. And then another reminder request, please, if you are not the presenter, please be sure to mute your microphone so we don't have background noise, reverb, anything like that. With that, I will turn it over to our friends over at the Milliman team to drive today's presentation.
All right, very good. I'm Fritz Bush. I'm a principal and consulting actuary with Milliman. And I have Kathy Ely with me as well. And we're going to walk through this data. I'm going to attempt to share my screen first. All right, what are you seeing right now? Is that the front page?
We're actually seeing the presenter slide.
Oh, I got to switch my screen then. All right, hang on.
Yeah.
Let's see, swap it. There we go. How's
there you
that?
Go. You're
there
good.
We go. All right. All right, very good. Yeah. All right. So first of all, thank you for everybody for coming. We are in our second year of the waiver, the public option and reinsurance waiver. We asked for this data last year as well. So we're going to go through. We got a lot of questions last year, and we did a lot of responding in terms of how we developed the premium to the feedback that you guys gave us. So if you're new to this, then we're going to the data request. We'll go through that. It's almost identical to last year if you were here again. So that's the good news. So we'll go through that. We'll talk a little bit here about the reference premium development, give you some background around why we're actually collecting the data, talk about the data request, and then next steps. All right. So again, if you are not familiar with what the reference premium is doing, this is a part of the 1332 waiver. It is the part of the waiver that involves the battle-born state plans, the BBSPs. So as a part of that, well, actually it involves both, but the reference premium itself directly affects the rates that BBSPs are required to set. The reference premium is basically, the idea behind it is that we are developing our best estimate of the market premium by region. So what would effectively be the second lowest cost silver in each region. This is all by law, by the way. This was a law passed now a couple of years ago that requires this to be done, and then BBSP rates are set relative to that. The reference premium itself is intended to be what the rates would otherwise be if the waiver were not in place. Okay, so that's really important to understand here, is that there's no the effective reinsurance is not built into the reference premium. So it's intended to be essentially a no waiver type development. So then what happens is the effect of the reinsurance for that year is layered on, because the reinsurance is going to change each year. It's going to go, or it could change each year. And from there, then the BBSP plans will have what's called a premium target that is set relative to that reference premium. So that's why everybody in the market is required to put this data in, because it is supposed to be a market premium development, not just, even though BBSPs are going to set their rates relative to the reference premium, it is intended to be a market premium, not just BBSP. So, so you can see a couple of the bullet points there. Reference premiums are intended to track consistently with the overall market, reflect changes if there were no BBSPs or reinsurance. Capture the market dynamics that are not reflected in the CPIM. The reason the CPIM is important here is because that's actually what was in the law. It was actually what was, the law actually had a different index, but it was changed by regulation to be CPIM. As you know, as actuaries, CPI medical does not capture all the things that go into an insurance premium. So it was changed such that we could capture that, and this reference premium development is intended to capture that piece. So it's really important for everybody to set an actuarially sound rate here, that we get good estimates on this. We want to be accurate. Third bullet point there, under trending, the reference premium sets unrealistic targets for BBSP plans and risks destabilizing the market. So we do not want to make the reference premium aggressive, and we don't want to make it conservative. We want our best estimate on the reference premium, because it's not in anybody's best interest to have something that is either under or over the actual market rates. And then the last bullet there, over trending or under trending, this does impact pass-through funding. And we'll talk a little bit about the rates, the counterfactual rates, the three rate scenarios here in a minute, and how important those are as well. There is actual dollars in play here with CMS in terms of pass-through funding. So this is, it's why we wanted to have the webinar too, is to emphasize that it's important to be accurate. Okay, this is what the data request looks like. Again, you should remember this from last year. If you're new, I'll go through this pretty quickly here. But at a high level, what we are attempting to ascertain here is, when you, as a pricing actuary, go to do your pricing this year, you're effectively going to be doing a couple things. You're going to be restating, right? You're going to take last year's trend in your first year, and you're going to substitute actual experience for it. And then you're going to restate your second year of trend, which will now become your first year of trend. So there's two components to the restatement that everybody does in a pricing exercise, and one is relevant to the first year of trend, and the other one is relevant to the experience period. You're basically substituting and rolling everything forward. And so that is what we want to try to get at here at a high level. And then we need, of course, an estimate of what your projected trend will be from 26 to 27. So if you think of it at a high level, that's basically what it is. You've got a restatement on your 26 rates, and then you've got a projection to up to your 27 rates. And that's what we need to try to, that's sort of breaking it down at the simplest level. So if you look also rating area 1, 2, 3, 4, we want to do it. Part of the feedback we got last year was that our setting of the premiums wasn't particularly accurate at the area level. There's a couple carriers that gave us that feedback. So we will attempt to do a better job by area, but of course we need accurate data by area as well. So question number 1 says, what is your current estimate of medical and RX allowed trends from 26 to 27? Okay, so this is really just what would be your second year of trend. It's what you think, going from 26 into 27, how you think that's going to develop. So that's the projection part of this. That's pretty straightforward. We are asking for unit cost and utilization split, if possible. The second question is, what is your current estimate of percentage impact of restatements, impact of restatements or pricing corrections in 2027 pricing relative to 2026? So that's what I was saying before, is you're gonna have a better estimate of what your 26 pricing should have been now that you have more data. And that's what we're trying to get to on that. That's essentially restating the starting point. Okay, so that's what I was talking about before, is these are really the two main components here in questions 1 and 2. And then the third question, this year, hopefully this list is a little less long than it was last year. We had quite a bit going on for 2026, although there could be, this is just basically a catch-all bucket that when you take like question number 1 up there, right? You might have an underlying trend that's coming from your cost of care development. That's just sort of a run rate type trend. But then there's other things that you're going to want to reflect. Last year, of course, it was the expiration of subsidies. You could have other things in there that are one-time market impacts that are that will roll into your pricing. That would be in addition to just the basic pricing mechanics that's contained in questions 1 and 2. So enumerating those, we leave some space, A, B, C, D, and E there. If you have more, feel free to put it in there. And of course, any detail that you can give us is going to help us. So feel free, there's a wide description box there, but if you want to give us more detail on why that's included, why it's not included elsewhere, what it is exactly, that would definitely help us out a lot. Question 4 is very simple, projected membership by area so that we can do a proper weighting. And then the last question is new this year. It's really trying to sort of ascertain how people's, it's maybe a gut check or a different way of getting at question 2 above, but it's basically at this point in 2025, depending on the risk adjustment estimates that you have in place, which you should all have a risk adjustment estimate since you did it for annual statements. But here we're trying to get at the run rate loss ratio. And what we mean by run rate loss ratio is essentially it's what the actuaries use to do pricing, not the accounting stuff. Okay. So if you have a PDR or anything like that, exclude all that. This is the stuff, this is the loss ratio that you would take. You can see the definition there, incurred claims with all the run out, with everything restated for prior period development, all that. Incurred claims divided by premiums plus risk adjustment. So this is an attempt to get upfront for something we asked for later after last year, we asked for that afterwards. And actually, it was somebody on this call that actually sent us the data because it was public by that point. But we would rather, if you want a good draft of this, it's in your best interest to try to get us an accurate number there, because then we can fold that into the draft reference premium. We can get that earlier rather than later. All right, let's go to the next slide. I don't want to take up too much time, which I already am. Oh, wait, I'm running it. Sorry, there we go. So we're on the 26th now, so we have till tomorrow. That's why we're having this webinar, so we provide you a little bit of time to ask questions today. That's why I'm going to stop talking here in a little bit. Draft reference premium will be next week, and then we'll be finalizing by May 1st. By the way, you can also send an email to myself or to Kathy. I think we have our contact. Hopefully we have our contact information here. And then there's the timeline. And with that, we've got, this is the development of the reference premium last year. I'm not going to go through that right now. That's there for your reference, though. So I want to stop talking, give as much time for questions as possible for people.
So we did have one question in the chat. Kathy answered it, but just for people who might not catch it, question was on number 4, is the preference for your team to use members or member months? And Kathy responded, either one would be fine, just as long as you clearly indicate which metric you're using, so the Milliman team can actually compare appropriate standards.
And I want to, I know I was supposed to stop talking, but I want to hit on this real quick. And Miley maybe wants to jump in too. I mentioned it earlier. The counterfactual rates. There's a couple pieces to us being able to comply with the waiver, and then obtain pass-through funding. And that what we're going through today is part of it. And the other part of it is the counterfactual rates are really important. So, but I don't know, Miley, I know you're those are all going to be submitted to you. So I don't know if you want to add anything to that.
No, I think by the end of the filing season last year, everyone pretty well understood what needed to be done, but we can,
Yep.
we have a carrier webinar later. We can kind of mention what we're expecting on that.
Great. All right. Any other questions anybody wants to ask on the data request?
Yes, hi, this is Heather from Centene. There is language in there around allowed trends and then some language that seems to indicate, premium trends. Just curious how you are using each of these to get a total premium change component and what type of adjustments you're making.
Let's see. I see allowed trend in question 1. Is your question related to like that the data request doesn't really take into account maybe non-claims items such as admin or commissions or profit? Is that where you're trying to get to, or I may not
Right.
understand your question. Yeah.
Yeah, I'm wondering if we need to convert them to be on a consistent basis or how you're taking each of these numbers. Are you multiplying them to each other to get a premium change? Yeah, kind of how we should consider the different way we're reporting these.
That is a good question. Yeah, because like as an example, 1-on-1, if you're asking for allowed trends, it's not gonna hit your fixed admin, right? So you would need a place in there, for example, maybe in question number 3 to add. I guess it would be changes to non-benefit expense items, right? Which could be admin, commissions, profit. That might be the easiest way at this point to reflect those, if there are any. Because ultimately, you are correct, Heather. We do. That's good feedback. We should probably be consistent with that. We are. It is actually a premium development. So, so I think maybe that's the way we handle it. Is that ultimately the questions can stay as they are, but if there are meaningful changes to non-medical or RX expense, which would be captured in like questions 1 and 2, maybe they should go in item number 3. Does that help?
Yes, thanks.
Do we have any other questions from our attendees today?
If no one else has any others, I have one more. This is my first time this year being involved in this, and I was curious if you could walk through roughly how you use each of these numbers to get the target premium. If maybe that's something you had gone through in prior years. But yeah, I was curious, you're collecting this from each carrier. How are you approaching setting this using these values?
So I can go through, since we do have a little bit of time, I'll reshare my screen. And then since we maybe don't have a ton of time, we are always available if anybody wants to set up additional time to go through how we do this. We'd be glad to go through in more detail. But this is the No, I think I had it right the first time. Do I need to go back?
No, this is good, Fritz.
Is that it? Okay, all right. Yeah, so this is the buildup of the 26 reference premium, and the inputs you can see are highlighted in the brackets here. I think that bracket is slightly off, but it shouldn't actually include CPI there. That's just a known number. But the way that the reference premium is built up is we actually start, this was last year, so all these years are going to be bumped ahead 1 year. And so we actually start with the known rates that are out there for 2026. By law, I don't want to get too deep into this, by law, it actually starts with 2024. That's the beginning of the reference premium development by law. But because we have CPI and then we have the other adjustments for things that are not contained in CPI, what we do is we assume that the rates that are currently out there are the market's best estimate of all of the other parameters, that the trend and all of this other stuff. That's all baked into the most recent rate. So for last year's premium development, we actually started with 2025. All right, so that now that you know that we're starting with 2025, well, last year then of course we asked for trend and any restatements that you might have for 2025, because that's what we were starting with. So we actually start on line 2 there, and then this year, of course, again, everything will be bumped ahead a year. But where this data ends up coming in, as you can see down here, there's a number of different inputs that came, mostly starting at line, well, it's really 6 and below. Like I said, that bracket is probably just off slightly. But all of that is what comes with the data request. So 7 is your emerging experience restatement. Last year, you can see, this is where we got some of the feedback, was the emerging experience and restatements wasn't uniform across the market. And we got feedback that, well, that number should probably be more area specific, which means you have to submit it area specific. But that's where that rolled in. And as you can see, that was a pretty big number last year because, experience was coming in pretty poorly. Now this year that who knows what that could be, but and then of course there was the 2025 morbidity. So anything that came out of the restatement, if you reassessed morbidity, anything like that, is basically fair game to adjust for. So some of the market effects that we mentioned, and last year it was end of the PTCs. Most carriers had something in there for the tariffs at the time, which I don't think they ever came to pass. But anyway, that's where all of that data that comes out of the data request ends up going in here somewhere.
Explicitly as like a weighted average across carriers, or how are you approaching that?
Yeah, it was a weighted average. I can't say that there wasn't some judgment in there as well, because we had to do some interpretation. But essentially a weighted average, which, as you know, is not exactly accurate, right? Because in reality, everybody's going to have different movement. But that's how this needs to be done. So.
Okay, great. Thank you, Fritz.
Yeah, and feel free to reach out too if you want to. This is a public document, the reference premium is. So if you actually can't tell you where to get it, we can find out and let you know, but it is actually public. So if you look at it, if anybody has questions, feedback, please let us know.
Yeah, because those of you who did this last year might remember that there were several versions of the reference premium. And the early one didn't have that much detail because we started out thinking like, oh, we need the second lowest cost silver, and what's everyone's trend going to be. And then, through feedback and as things changed over June, July, August, it became clear that there were other pieces that we really did need to include that weren't going to be so much reflected in what y'all used for the carrier trend, but all of those additional adjustments that were also contributing to premium changes. And so to Fritz's point, like the more feedback that we get, the better we can develop this.
All right, we're starting to run up on our estimated time. One last call for any questions. Not seeing any. I did pop into our chat for this session, our general 1332 waiver inbox. So if you do have questions and you don't know exactly where to route them, send them to that box and we will get them routed to the appropriate folks. As mentioned at the beginning, this is being recorded. We will post the recording and the slide deck to the Health Authority website. If you're unaware, the Health Authority just had our website like created and revamped. So I can't tell you exactly where it's going to end up on that website as of this exact moment. But once it gets posted, we will send links to the distribution list that we sent the actual meeting invites to. So with that, Fritz, Kathy, thank you for running this and providing your feedback. And hopefully everyone has a wonderful rate development submission season.